So this is where we left off last time with the breast self-exam. So BSE is started at age 20, and research does show that BSE plays a small role in finding breast cancer early. It used to be that we were very much stressing that women do the BSE every month and very important that they did it. Now the importance is still there, but it's just not being stressed quite as much with breast cancer prevention and detection. You want to provide a private and comfortable space, undress from the waist up, and then provide with a gown and sheet, and have the client demonstrate their own method. Basically, the biggest thing with BSE is it helps the client to recognize their own breast tissue and feel the ins and outs, the different textures and the different contours of their own breast tissue, and they get to know what that normal is. And so then if there is something that comes up, they will recognize that. With the BSE, the process, you want to stand in front of the mirror. There's just a couple things that you want to make sure and do, and that is to look at the breast tissue for abnormalities, compare the shape and size, look at nipples, look at the skin. We'll show some different problems with the skin later in a couple other slides. And then look at the same things with those arms raised above the head, and then press hands to the hips to emphasize any changes in the shapes of the breast. So you want to look at that in the mirror. So again, with the BSE, the process of it, you want to make sure they examine the breast while they're lying down and while showering. A lot of women do find that showering is an easy method because the skin is slippery and it's easy to feel any problems. Okay. While lying down, while lying supine, the arms should be overhead. So, for example, that if you're looking at if you're feeling the right breast, you want that right arm overhead, and then you would feel with the left fingers. Demonstrate the correct amount of pressure and correct position of the hands, and the finger pads need to be used to palpate, and then make sure you tell them the entire breast and tissue of the axillary area should be palpated. You're looking at, that's called the tail of Spence, and then look for any nipple discharge. So you want to end the exam with squeezing the nipple to see if there is any discharge there. When to perform the BSE, there's two categories, premenopausal or menopausal. And so premenopausal, before women have ended, having menses, that's going to be a week after their cycle. So day 1 is the first day of your period. You're going to do your breast exam at day 7. So in general, it's 7 to 10, days 7 to 10 of the cycle. And then postmenopausal, they just need to pick a day every month and do it the same. And on this slide, we are just looking at the different processes, the process of the BSE. So you look across the top there, number 1, where you're looking at the breast tissue, and then what we said, with the arms above, hands on the hips, and then doing the exam, and then it shows, when they're laying down. And there's different methods, and you can review in your book, chapter 73, different methods to show you, up and down or a circular motion is fine. As long as they're, reviewing the entire, palpating the entire breast, they're going to be fine. Other diagnostic assessments that you see, ultrasound is used to clarify mammography findings. It's a good test to use with a mammogram, costs less than the other tests like MRI, should not be used in place of a mammo. It looks at areas of concern. So if they see something where the mammogram has revealed some areas where they're wondering what's going on, then they will do an ultrasound to check that. And then distinguishes fluid-filled cyst from a solid tumor. It does help to see that. A biopsy is another assessment, and we will talk about that a little more later on, but as far as the sentinel node biopsy, but in general, the biopsies here is fluid or tissue removed from the breast to determine if cancer cells are present. And I will probably show this video on Monday. It's a little 3-minute video that shows the various biopsy techniques from Susan Komen Foundation. So the 3 that are listed there on this slide is a fine needle aspiration, a core biopsy, and a surgical biopsy. And like I said, we'll cover those. I'll quickly review that on Monday. The surgical biopsy, of course, would be the most invasive here.